I'm Dr. Mel. I am a pediatrician and I want to talk about the 14-year-old boy who was allegedly slapped by his teacher.
Pananampal ng kanyang guro ang kanyang 14 na taong gulang na anak na lalaki.
The autopsy result of this 14-year-old grade 5 student who was allegedly slapped by his teacher in Antipolo City, Philippines was released yesterday. The investigation showed that the teacher allegedly slapped the student last September 20 at around 9 a.m. The mother of this student claimed that his son complained of headache when he arrived from school. The boy also said he also felt dizzy and there was pain in the ear. However, he was still able to attend classes for 3 days after the incident. 6 days after the alleged slapping incident, this boy was brought to a government hospital because his condition worsened. Unfortunately, he went into coma and died after 6 days stay in the hospital. Is the alleged slapping incident related to the cause of death? Is this a cause of traumatic brain injury? Before going to the autopsy result, gusto ko pong i-share po sa inyo what happens during a traumatic brain injury so you will know what to do when you experience the same situation. Traumatic brain injury usually results from a violent blow or jolt to the head or body. Take note of the word violent. So, it should really be a strong blow. If there is a history of fall, then it should be a strong one. Kaya for this patient, may mga nagwa-wonder if the slap was strong enough to cause the traumatic brain injury.
May umanong nagsasabi na imposibleng masawi sa isang sampal lamang ang tao, maaaring lubhang nasaktan at malakas ang pagkakahampa sa kanyang anak.
Traumatic brain injury can have wide range of physical and psychological effects. Some signs or symptoms may appear immediately after the traumatic event within 24 hours, just like this patient who developed headache immediately, while others may appear days or weeks later. Here are the physical signs and symptoms of mild traumatic brain injury. Headache, nausea or vomiting, fatigue or drowsiness, dizziness or loss of balance, loss of consciousness. But if there's no loss of consciousness, but there is a state of being dazed, confused, or disoriented, I think all these signs and symptoms were present in this patient. Let's listen to the mom of this patient.
Susuka, pag susuka po, tapos yung mga kinain niya po, tapos pananakit ng ulo, tapos pag sumakit daw ang ulo niya, parang maraming gumagapang sa tainga niyang, sa kanang tainga niya, maraming gumagapang, tapos sobrang sakit daw po talaga ng ulo niya, pati mata niya nang lalabo.
How about in children? What are the signs and symptoms of traumatic brain injury among children? Infants and young children with brain injuries will not be able to communicate headaches, sensory problems, confusion, and other similar symptoms. Be alert to look for these symptoms if your child or grandchild has a history of fall or head trauma. The most common symptom I usually see among pediatric patients is nausea and vomiting, accompanied by irritability, persistent crying, and you are unable to console the child. There could also be drowsiness and development of fever. Always see your doctor if you or your child has received a blow to the head or body that concerns you or causes behavioral changes. Seek emergency medical care if there are any signs or symptoms of traumatic injury following a recent blow or traumatic injury to the head. Ideally, this young boy should have been brought to the emergency room immediately because he developed headache when he went home. Cranial CT scan could have been done to fully evaluate the child. I hope you learned something on traumatic brain injury. Going back to the patient, namatay ba yung patient dahil sa sampal? Did the patient die due to the slapping incident? What do you think? Please comment down below. Is the teacher liable? By the way, I strongly believe that the slapping incident was an unprofessional way of disciplining a child, and it should not have been done to the child or to any student. Tama po ba ako? Am I right? Thank you for sharing your views below. Unfortunately, ito po ang result ng autopsy.
Examination showed cerebral edema secondary to intracerebral hemorrhage consistent with ruptured arteriovenous malformation.
A brain arteriovenous malformation or AVM is a tangle of blood vessels that connects arteries and veins in the brain. So ito po ay inborn na malformation na nagkabuhol-buhol yung ugat sa utak. An arteriovenous malformation can develop anywhere in the body, but common locations include the brain and spinal cord. Some people with brain AVM experienced the signs and symptoms which were all felt by the patient mentioned earlier. Ano po ba ang cause ng AVM, Doktora? You might ask. Actually po, the cause of brain AVMs is not clear. Most people are born with them, but they can form later in life. So, with this patient, inborn yung problema niya. Meron na po siya since birth. I think coincidental lang yung occurrence ng symptoms with the sampal. Sooner or later, the symptoms of AVM will appear. The AVM ruptured, which caused the brain hemorrhage and eventually the death of this young boy. If you like this video, please don't forget to subscribe, like, and share. Thank you for watching.